What is IVF?
IVF, or in vitro fertilization, or what we commonly call test tube babies, is a process of fertilizing the sperm and the human egg outside the body. This process normally happens inside the human body in what we call the fallopian tubes.
Who do you think need IVF?
IVF is required by those couples in which one or the other partner may have blocked tubes, poor quality sperms, bad quality eggs, or a condition called endometriosis. If the couple has failed other forms of treatment like intrauterine insemination or IUI, they may also require IVF. Having said so, it is also true that IVF gives us more success rate than any other treatment. And there are many couples who come in and say that they would like IVF as the first line treatment because it gives them more success. Personally, I don't think there's any harm in doing so.
Is IVF you think is the last treatment option?
A lot of people ask me if IVF is the last treatment and they would like to try everything else before doing an IVF. I think when IVF is advised, it is usually advised as the best treatment, not the last treatment. For example, if someone has very high blood pressure and they've been advised medicines to control this blood pressure and they say, can I try everything else before trying a medicine for blood pressure? It's wrong, because not using that medication for blood pressure may cost you your life. So if there is a good treatment available like IVF and it can give you a pregnancy soon enough, then it's wrong not to try an IVF, because otherwise you waste time as well as a lot of financial resources.
What is the process of IVF?
In IVF, a lot of eggs are required. Thus, injections are given to make these eggs. The monitoring of the growth is done by doing ultrasound and blood tests. When we feel that the eggs are ready, anesthesia is given, and then with the help of an ultrasound and a needle being passed over the ultrasound, eggs are sucked out from the ovaries. These eggs are now put into a petri dish, mixed with the sperms, fertilized, embryos are created, and these embryos are now transferred back with the help of a fine catheter inside the uterine cavity.
Do you think IVF reduces the eggs, since a lot of eggs are taken out that cause early menopause?
Every month, the body recruits about 25 to 30 eggs for development. Under normal circumstances, when no medicines are used, only one out of these 25 or 30 eggs will become mature for development and get ultimately released. The rest of them will perish and die. In IVF, we do not allow these extra eggs to perish and die. So we try and make more of them and then take them out. But since they were anyways destined to die, doing an IVF does not take away the numbers and does not make the total numbers lesser. Thus, it has been conclusively proved that doing IVF and giving injections for IVF does not bring about menopause earlier than normal.
Another question definitely is IVF a painful procedure?
I always tell patients that the pain of IVF is more mental than physical. The pain comes from stopping your life, making compromises in your schedules to come to clinic, waiting here for the endless ultrasounds, blood tests, results, injections, and so on and so forth, having gone through the entire process of IVF and yet not being able to achieve a success in one attempt. And the worst part is not even knowing what went wrong and whether in the next attempt we will be able to get a pregnancy. That, I think, is the biggest pain of IVF.
What is the success rate of IVF worldwide?
The success rate of IVF is about 40%, which means that if 100 people were to get this treatment done, about 40 people would conceive in the very first attempt, and the rest of them would have to come back and try once again.
Does IVF lead to increased miscarriages?
There is no increased risk of miscarriages in IVF as compared to the general population. That means if a woman conceives naturally without any treatment, there is a 5 to 10% possibility that she may have a miscarriage. And same is the case with IVF as well.
Is the success of IVF 40% guaranteed for everybody? And what does success depend upon?
40% success does not mean that every couple will be able to achieve this 40%. Those who have bad quality eggs, the woman's age is more than 35, she may have a problem called endometriosis, or if the husband has really very bad sperms, then the couple is not able to achieve this 40% success. Their success is going to be lower.
Before going for an IVF, what are the important things that needs to be gone through?
Many couples, when they come in for the first consult, they are always riding a horse and they wish to get the IVF done immediately, if possible the very next day itself. I often tell these couples that doing an IVF is like marrying off your daughter. You don't suddenly wake up one morning and say, okay, let's go and get married. What you do is you fix a date and then you work backwards to ensure that everything works smoothly and perfectly. IVF is also the same. There are so many things which are involved in getting a good IVF cycle that you would like to ensure that everything is good. For example, if the woman's hormones are not good, as simple as a vitamin D deficiency can reduce your fertility. A thyroid abnormality can cause an IVF failure. A sugar report can cause problems. So all these conditions need to be first corrected hormonally. The woman's womb needs to be checked to ensure that the womb is capable of receiving the embryo. The husband's sperms need to be checked. Some of his other hormones and blood tests need to be done to ensure there is no problem from his side. Only when all these are correct and good should IVF be done.
If you could explain hysteroscopy a little more in detail for us.
Hysteroscopy is a procedure of putting a telescope with a camera through the vagina, through the mouth of the womb, into the womb to look at the inside of the womb. And if there is a problem which exists there, like for example a wall which we call a septum or a polyp, it would be removed in the same sitting because the presence of any of these factors can be a hindrance to fertility.
What is ICSI?
ICSI or Intracytoplasmic sperm injection is the process of taking one healthy sperm and injecting it inside the egg under the guidance of a very high power microscope.
Is it better than IVF?
I'm often asked this question whether ICSI is better than IVF. The work of a needle can't be done with a sword. IVF and ICSI are meant for totally different problems, and the work of one cannot be done by the other. So sometimes in some problems IVF is better, and in some problems ICSI is required to be done. In fact, if you do ICSI for all the problems, then you're probably making a mistake somewhere.
Which are the couples who need the ICSI procedure?
ICSI is meant for those women who are of higher age, or maybe do not have good egg quality, or previously have failed fertilization in IVF, or if their husbands have excessively bad sperm count or sperm quality, then they require ICSI.
Can the success of IVF be increased more than 40%?
There are two procedures which can increase the IVF success to beyond 40%, taking it up to almost 55-60%. The first of them is PGS or pre-genetic screening of embryos. We know that even when we get good eggs and good sperms and make embryos, 40% of such embryos can be genetically abnormal. And if the eggs are not of good quality or the sperms are not of good quality, up to 80-90% embryos can be genetically abnormal. Now during transferring, normally we don't look at the genetics of these embryos and we transfer blindly. However, with pre-genetic screening, we can do a biopsy of these embryos and only those genetically healthy normal embryos can be transferred back, increasing the IVF success. The second procedure which can increase the IVF success is ERA or endometrial receptivity array, which is essentially a biopsy of the lining of the womb, which can tell us what is the right time to transfer the embryos back inside the womb.
Do patients who undergo IVF need bed rest throughout the pregnancy period?
It's a great myth that an IVF conception requires any special care or bed rest even the 9 months of pregnancy. You must understand that IVF is merely a process of bringing the sperm and the egg together to achieve fertilization and create an embryo. Once a pregnancy is achieved, it is like any other pregnancy. You can go out, you can go for movies, you can go for dinners, you can go to the gym and exercise, you can swim, you can even go for holidays. Yes, having said that, what is also true, like any other normal pregnancy, if there is any complication in the IVF pregnancy, then yes, for a short period of time, we may ask you for bed rest, but that's usually for a very short period.
Is there any harm or any long-term effects of a woman undergoing IVF?
The effect of IVF injections do not last beyond an hour. That is the very reason why they need to be given on a daily basis. It has been conclusively proved by research over the last 40-50 years that doing IVF does not cause any long-term complications to the woman undergoing IVF.
Is a child born out of IVF healthy and normal like any other child?
Think about it yourself. More than 5 million babies have been born through IVF. Who would come forward and get an IVF done for a baby knowing the child is going to be abnormal? Again, research has shown over the last 30-40 years that children born out of IVF are as normal as any other baby.
What are the complications of IVF which needs to be kept in mind?
The most important complication of IVF that we need to know about is OHSS or Ovarian Hyperstimulation Syndrome. This happens more in thin women who have polycystic ovaries. Now in IVF, when we give injections to make more eggs, we usually try and give a dose which was only going to produce 9 to about 15 eggs. But in some women, there is an increased tendency of producing eggs. This triggers off a certain hormone in the body which causes the ovaries to become very big. In majority of the women again, even if a complication happens, it is usually just an indigestion or a bloating sensation at the most. In less than 5% women, there might be fluid accumulation either in the tummy or in the lungs. Sometimes so much that we actually need to put a needle inside and take out the fluid. Now, it usually never reaches this stage. What we try and do is institute certain measures which make sure that the ovarian hyperstimulation does not happen in the first place. However, if at all the hyperstimulation does happen, we again put in certain amount of treatment to make sure it disappears as soon as possible. The good part about the ovarian hyperstimulation is that it's a self-limiting process. In about 7 days' time, it disappears on its own. There are other small little complications that one needs to know about IVF, like complications during taking out the eggs and complications of anesthesia. But they are so very rare that one doesn't really need to bother about these complications at all.
Besides OHSS, what are the other things that can go wrong in an IVF cycle?
Sometimes, despite injections, follicles do not form. What are follicles? Follicles are balloons which we see on ultrasound which contain the eggs. Now, it might so happen that we might see the follicles on ultrasound, but we actually when try and go and collect the eggs during IVF, there might be no eggs inside the follicles. Or we may get the eggs, but they may not be of good quality. Or they may not fertilize and make embryos. Or the embryos may form, but they may be of very poor quality and they may not grow. In all these conditions, sometimes, despite the best of our efforts, IVF cannot be done.
When is an embryo transfer done?
Embryo transfer is done on the 2nd day or the 3rd day or the 5th day after taking the eggs outside the human body and fertilizing them in an artificial environment. Now, day 5 embryos are really the best because it is the highest form of development possible outside the human body. So if an embryo reaches this blastocyst stage on day 5, we know that this embryo is the most hardy and the most strong and probably the most capable of giving us a pregnancy. Therefore, it is always our attempt to transfer a day 5 embryo unless there is some reason to transfer earlier than that.
What do you think? Is fresh embryo transfer better or a frozen embryo transfer better?
It has been conclusively proven through research that frozen embryo transfer is much better than doing a fresh embryo transfer. It has been shown that when we give injections to make eggs in a fresh cycle, something about the high hormone level causes a problem in the lining of the womb. And this causes the pregnancy rates to actually drop if we transfer the embryos back in a fresh cycle. So these embryos are then kept in a special container in which the temperature goes down to as low as minus 196 degrees centigrade. And then later on, maybe a month or two later, when the hormones have come back to normal, these embryos can now be transferred back inside the womb.
Does embryo freezing have any bad effect on the embryos? And how long can they be kept frozen?
Whenever we talk about embryo freezing and taking the embryos to almost minus 196 degrees centigrade, the question always arises that does freezing have a bad effect on the embryos? Will it cause any defect in the embryos? Will the child forming or delivering from a frozen embryo transfer have any abnormalities? Now, I'm sure all of you have seen English movies, science fiction movies. Embryo freezing is like those suspended animations that we see in science fiction English movies, wherein astronauts wake up maybe after 100 years and they're absolutely fine. Similarly, it has been shown through research that when embryos are frozen, there is no bad effect on the embryos which happens. And they can be safely frozen for maybe even 10, 20 years or so.
How many embryos are transferred back at one time? And what do you think are the chances of twin pregnancy?
The number of embryos we transferred back inside the womb depends on the quality of the embryos and the patient's wishes. For example, say someone already has a child, is now coming back to us for the second child. Obviously, we would like to transfer only one day 5 embryo so that the chances of having twins is minimal. On an average, if you ask me, we like to transfer 2 day 5 blastocyst embryos. The chances of having twins in any IVF is about 15 to 20%. However, sometimes even if we transfer one embryo, that one embryo may split into two and cause identical twins.
If a woman undergoes IVF and gets pregnant, is it necessary that when she will come for a second child, she also has to undergo an IVF, or can she get pregnant naturally?
The answer to this question is both yes and no. If IVF has been done for, say, a condition like blocked tubes, or someone has had their tubes tied or ligated, then after their first child, when they come back for a second child, they would have to do an IVF once again for a baby. There is no other way that they can conceive. However, we have also seen that in many conditions, the mere act of conceiving, having a child and delivering corrects some of the problems. And many cases wherein a couple has had an IVF conception before, but they have come back with a totally natural conception the second time. So yes, it is quite possible that after an IVF baby, you can have a normal natural conception.
A very preliminary question, what is the cost of IVF?
The cost of IVF can be divided into 4 stages. Number 1, the initial investigation stage, where we try and find out all the other associated problems for both the couple. Obviously, the cost will depend on what kind of problems the couple may have and the investigations we might need to do for them. The second stage is the correction stage, wherein the problems which we find in the initial stages need to be corrected. Again, the cost depends on what kind of corrective measures we have to employ to make those corrections. The third stage is the treatment stage, wherein the injections are started for making the eggs and doing the actual IVF. Here, the cost depends on the quality and the amount of injections we need to use for making the eggs. The last stage is the after treatment or post-treatment stage, where medicines are given for supporting the pregnancy, as well as the embryos are frozen. So obviously it would depend on how many embryos there are available for freezing. What we try and do is, after the initial consult, once we have a little information available with us, we arrange a cost counseling session wherein the counselor will sit down and, depending on your particular problem, give you an average estimate of how your IVF is going to be. If you ask me an average figure for doing an average IVF, I would say about 1.25 to 1.5 lakhs.
What if my eggs or my husband's sperms are not good enough?
It is possible that through investigations we find out that the eggs or the sperms are absolutely of horrible quality and they cannot be used at all. Yes, we still do try and give medicines to try and improve the quality of the eggs or the sperms. If that is not possible, or the couple wishes to have the highest possible success, then we have to change sometimes the eggs, sometimes the sperms, and sometimes both. Luckily, we run one of the largest oocyte banks in the east zone of India, and we run the largest sperm bank in the whole of India. So, we are in a position that if eggs are required, we can use eggs from a donor woman, or if sperms are required, that we use donated sperms.
And finally, any final message from your side for the couples who will come for the treatment?
You do need to understand that we can't play God. In this clinic, we try and incorporate the best of science and technology and use sincerity, honesty, and transparency along with that to give you our absolute best. But our best does not mean that we will always achieve success the first time. That is where willpower and faith comes in. We all know that there is light at the end of the tunnel. But when we are passing through that tunnel, it's always dark and scary. Here, I would like to recite a poem by the late Harivansh Rai Bachchan. लहरों से डरकर नौका पार नहीं होती, कोशिश करने वालों की कभी हार नहीं होती। नन्ही चींटी जब दाना लेकर चलती है, नन्ही चींटी जब दाना लेकर चलती है, चढ़ती दीवारों पर 100 बार फिसलती है। मन का उत्साह रगों में साहस भरता है, चढ़कर गिरना, गिरकर चढ़ना ना अखरता है। आखिर उसकी मेहनत बेकार नहीं होती, कोशिश करने वालों की कभी हार नहीं होती। डुबकियां सिंधु में गोताखोर लगाता है, डुबकियां सिंधु में गोताखोर लगाता है, जा जाकर खाली हाथ लौट कर आता है। मिलते नहीं सहज ही मोती गहरे पानी में, मिलते नहीं सहज ही मोती गहरे पानी में, बढ़ता दूना उत्साह इसी हैरानी में। मुट्ठी उसकी खाली हर बार नहीं होती, कोशिश करने वालों की कभी हार नहीं होती। असफलता एक चुनौती है, स्वीकार करो। असफलता एक चुनौती है, स्वीकार करो। क्या कमी रह गई देखो और सुधार करो। जब तक सफल ना हो नींद चैन का त्याग करो तुम। संघर्षों का मैदान छोड़ मत भागो तुम। कुछ किए बिना ही जय जयकार नहीं होती, कोशिश करने वालों की कभी हार नहीं होती।